My name's Kevin Dillon. I'm the Executive Director of the Connecticut Airport Authority. Throughout the pandemic, we've been very proactive in terms of passenger safety here at Bradley Airport. We've placed a very high value on that. We were one of the first airports to require face coverings. We also substantially enhanced all of our policies and procedures here at the airport to ensure safety and convenience for our passengers. We were also one of the first airports to open a COVID testing site, and today we're one of the few airports that has health accreditation from ACI, that's the Airport Council International. So certainly it's a natural next step for us to have a vaccination clinic here at the airport. Starting today at 11 o'clock, we'll be hosting that clinic in conjunction with our partners, Griffin Health and the Connecticut Department of Health. It'll be a free clinic. It's going to operate for a 7-day period from 11 in the morning to 7 at night. We'll do an evaluation at the end of that period to see whether or not it should be continued. It's going to be open to all of our passengers, all of our employees and visitors here at the airport. So at this point, it's my pleasure to introduce the Acting Commissioner of the Department of Health, Dr. Deidre Fitzgerald.
Thank you, Kevin, and good morning, everyone. Deidre Gifford, Acting Commissioner at the Department of Public Health. Kevin, on behalf of the Department of Public Health and the Governor, I just want to say thank you to you and everyone at Bradley International Airport for your really strong partnership throughout the pandemic. Today is a great day. Starting off this vaccination clinic down in baggage claim. I encourage you to go down and check it out if you haven't seen it yet, where we're offering yet another option for people to get vaccinated here in the state of Connecticut. I also want to say thank you to Patrick and the entire Griffin Health team for their work, not only here at Bradley, but in the DPH and Griffin yellow vans that are deployed all over the state. Coordinating these free walk-up clinics in places where we hope people will take the opportunity to get vaccinated. Griffin has been a really tremendous partner throughout the pandemic, and we're so grateful for your continuing efforts in vaccination. Even though Connecticut has been and continues to be a national leader in the vaccination program for COVID-19, there's still more to be done to make sure that all of our residents have easy access to vaccination and that everyone gets their questions answered and has an opportunity to get vaccinated. Too many of us have known people who have been ill with COVID or have lost loved ones to COVID-19. And the only way to get past this pandemic is for everyone to get vaccinated. That's why partnerships like this are so critical to help Connecticut continue to turn the corner on the pandemic. This summer, as you know, if you've been looking at our numbers over the past few weeks, this summer is looking much brighter even than last summer, where our numbers were low. And this clinic is providing a really convenient option for travelers to receive the vaccine and head out into the summer season knowing that they're fully protected from getting COVID. We've administered more than 4 million doses of the COVID vaccine here in the state. Nearly 63% of our residents 12 and over are fully vaccinated, and about 72% of our residents 12 and over have received one dose. About 78% of our adults have received at least one dose of the COVID vaccine. So that's really terrific, but we have pockets still here in Connecticut where we need to make more progress. Some of our cities have about 40% of their population vaccinated, and in the younger age groups, that number is as low as the mid-30% of the population that's received one dose. So together with our partners, we're still continuing to make every effort to make sure everyone knows where to get vaccinated, gets their questions answered, and has easy access to a no-cost vaccine. Once again, I want to say thank you to Griffin and the Airport Authority for making this day possible. Thank you very much.
Hi, good morning. I'm Pat Charmell. I'm the President and CEO of Griffin Health, and we're pleased to be here today in partnership with the Airport Authority and our ongoing collaboration with the Department of Public Health to offer mobile vaccination across the state. We've been at this now since April. We now have 35 mobile vaccination teams deployed throughout the state. We're getting to those locations where it's been difficult for the population to access vaccination, but we're also looking now at locations where there's a lot of activity. So we meet people where they are. We've been in locations from A to Z. We've been in aquariums, we've been in zoos, we've been on beaches and boardwalks and beauty salons and cinemas and supermarkets, on churches and community centers. And we're finding this to be very effective, especially as some of the mass vaccination sites across the state that did yeoman's work at the beginning of the vaccination effort begin to close. The mobile vaccination effort becomes more important. As people are getting out, and we can see travel here at the airport, the number of travelers now has increased dramatically. It's not back to the 2019 levels, but we have 200,000 a week coming through. We're hoping to make it convenient for those travelers who have an interest in vaccination. We're in baggage claim. We expect people will be interested in vaccinating when they return from their trip, not necessarily on the way out. There has been some reluctance, as the commissioner referred to, but we've done hundreds of thousands of vaccinations, and we know that the effects of the vaccination are mild: a sore arm, a low-grade fever, some chills that last only a day. Some of the concerns that people had early on when we started to vaccinate in December about the effects of the vaccine haven't borne out. So those that have been waiting since December saying, well, I want to give it more time, now's the time. And we want to be here for people when they make that decision. And even if they're reluctant, still come and visit us at one of our vaccination clinics. We'll provide you with information, we'll provide with support, we'll help you overcome whatever remaining concerns you have. But again, we're so glad to be here at Bradley International Airport, and thank you to Kevin and the authority for having us. We hope this is a successful venue and will stay as long as people want to access vaccine here. So thank you.
Okay, we can open it up to any questions you might have.
Yeah, so who necessarily is the target audience? Is the target audience travelers? Is the target audience people who are in this area? Who are we trying to get with this vaccine program?
The target audience is anyone who's unvaccinated and wants to get vaccinated. So a guest here at the airport, as Kevin said, employees of the Airport Authority, travelers, family members picking up or dropping off travelers. So is anybody who's unvaccinated and happens to be at the airport is the target audience.
How do you think that we can touching people from other states where, I don't know what the vaccine setup looks like in other states, so.
The vaccine supply all over the country is plentiful, and access to vaccine in the United States, thankfully, is not really a problem in any state. So we don't anticipate lots of out-of-state demand, but anybody who's here at the airport can get vaccinated.
And so it's going to be for 7 days, and then you're going to reassess what the success of it?
Yes, absolutely. In collaboration with the Department of Public Health and the authority, I just want to add there's still over 800,000 eligible adults in Connecticut that haven't been vaccinated. So again, lots of people traveling to the airport, as commissioners said, families, folks who are dropping off, picking up. It's a very accessible location, so people can travel in easily. We're promoting the fact that we have this clinic here on the DPH website, on the Griffin website, on the authority's website. So we'll make sure that it has high visibility, and it's just one more place that people can easily get their vaccination.
So this is all, so as you said, the mass vaccine clinics are closing pretty much at the end of the month. So this is a more targeted approach to get the most people a public area, I guess.
Yes, and we've gone to sort of microsites, as I mentioned, beauty salons, church basements, community centers, supermarkets, and some larger venues as well. Right? We've been at Hammonasset and beaches, we've been at museums, we've been at places where we know people are going to congregate, theaters, concerts, and then again, in neighborhoods where people have difficult traveling out of their neighborhood, or where we can provide local community support and capitalize on the relationships that local providers have in those communities.
So to that last point Pat made, one of the things that we've been working on is we had a very large effort doing contact tracing here in Connecticut. And we don't need as many contact tracers as we needed previously. And many of the contact tracers that were working for us have now switched to working in collaboration with our van outreach program. And they are sort of traveling side by side and drumming up business, walking around, greeting people, asking them if they have questions about vaccine, do they want to get vaccinated? And we found that when we pair our outreach specialists from our contact tracing program, who are from the communities in which we're giving vaccine, with the mobile program, we get lots better uptake. So that's another way that we're working in partnership to make sure that anybody who needs a vaccine can get one.
Can you just speak to, I've had a lot of reader questions about this recently, but the Delta variant,
Yes.
how prevalent is that in our state, and is the vaccine effective?
So thank you for asking that question. It's a really important point. The Delta variant, which is the variant that is now the predominant variant in the United Kingdom, is probably more infectious and maybe more deadly than the previous variants that we saw, or the wild type, the original coronavirus that we were dealing with. We do have some cases of the Delta variant in Connecticut, about 40. So not a huge number, but we don't have a lot of cases in general. The B117 is still by far the most common variant here in Connecticut. But that variant has proven that after only one vaccine, you're not as well protected against the Delta variant. So it's very important that people get vaccinated so that we don't see the Delta variant begin to take hold here in Connecticut or elsewhere in the United States. And also that if you start your series, please complete it 3 or 4 weeks later, because the Delta variant does seem to have some properties that it's not as effective after only one dose.
Do we know how many people in Connecticut haven't gotten their second dose?
In general, we've been doing very well. Around 96 or 97% of people who are eligible for a second dose have taken their second dose, so people have been terrific about that. We're doing lots of outreach with our partners. We're making phone calls, reminding people, but we're doing pretty well here in Connecticut on the second dose. We have all three. We have Moderna, we have Pfizer, and we have J&J. So if you'd like one shot, one and done with the J&J like I had, that's available. If you prefer one of the mRNA vaccines, they have those down there too. Yep. They can go to ct.gov/COVID vaccine and they can find a location. They can walk into a pharmacy. They can go to the Griffin Health site and find out where the vans are going to be if they want to get their second shot at a van. So there are a lot of options for people to follow up. You don't need to get your second dose in the same location that you got your first dose.